Hello everybody, welcome to Dr. Chan's Minor Ailments Forum today. So first of all, I need to say Merry Christmas and Happy New Year. And secondly, I need to apologize that I haven't had a chance to do any videos recently. So you know how it's like, Christmas and New Year is always a bit busy. But today I'm going to talk about a condition that's extremely common in children, especially if they're younger than 2 years old. And the name of this condition is bronchiolitis. So bronchiolitis, let's explain the name first. Any medical name that ended up with itis or spelled as itis generally means inflammation. So when you look at the name bronchiolitis, you might be able to guess that this is the inflammation of the bronchioles. So bronchioles are very small airway that branches off from our bronchus and joining to the alveoli, which is where the air exchange and we get rid of the toxins from our body, etc. So you can imagine that children with a smaller airway, they tend to get more problem if they have got infection or inflammation of the smaller airways, which make them harder to breathe. And because of the inflammation, it also creates mucus and make it even harder to breathe. So when I said it's not very common in children, I meant very young children, for example, those younger than 2 years old. And also it's more prone in children who are born prematurely, or as another interesting fact, that any babies who are breastfed less than 3 months are more likely to get bronchiolitis when compared to those that has been breastfed for more than 3 months. So that's quite an interesting fact. So you can imagine that when the airway constricts or inflamed, the air is harder to get into the lungs. So the presentation of bronchiolitis would be initially presented like a cold. So for the first 1 to 3 days, you might not be able to tell whether it's just a cold or bronchiolitis. So the baby would be like a little bit grumpy and the temperature might be slightly up and they have a runny nose or cough. If it's bronchiolitis, it will generally progress in 3 to 5 days. They tend to be very grumpy and irritable, and they would be find it difficult to feed because they can't breathe through the nose. It's really hard for them to feed, and also would have a cough and would be wheezing as well. So these are the more or less cardinal signs to look out for whether this is bronchiolitis or not. So when we see the babies, and mum or dad might say, well, actually, he or she feeds really well normally, but now she's not really eating, not even drinking. And whenever she's being fed, she vomits. And I really worry because he or she has been making less wet nappies. So these are the serious cases that we need to spot. Because generally speaking, bronchiolitis is very self-limiting, and in 7 to 10 days, these children tend to get better on their own with supportive treatment like, paracetamol and maybe an inhalers or something. But obviously those cases that I mentioned earlier on, if they are producing less wet nappies, if they're not really feeding really well, very grumpy and very wheezy, these children might actually need something more. For example, they might need to be in the hospital to be monitored. So if we do see children with suspected bronchiolitis, if they're mild, I would have sent them home with a supportive treatment. I might give them an inhaler to take home just to make them breathe a little bit easier. If it's moderate to severe case like those that I mentioned earlier on, I probably will have a chat with the pediatric registrar to see if he or she feels that these children need to go in to be monitored. The good news is with bronchiolitis, the general outcome is very good. They tend to all get better after 2 to 3 weeks maximum. And the most important thing that we need to think about is spotting them early, I think, because supportive treatment is important. And if you suspect anyone who's got bronchiolitis, number one thing that you should do is to contact your GP and for the patient to be seen, because once the diagnosis has been made, then we can do correct treatment for them. And another thing is, some people might say, well, will steroid help in this kind of situation? Interestingly, a study shown that giving steroid to children with bronchiolitis doesn't actually make a massive difference to the progression of the disease, but sometimes it's used, especially if they're in the hospital, and also nebulizer might be used as well to kind of drive the inhaler into the lungs better. So the bottom line is, make sure you spot these children early, because earlier treatment make them feel a bit better and they feed better as well. So I hope that this information is useful for you, and next time round I'm going to talk about asthma and COPD. Until next time, take care of yourself. Bye bye.